Yes, we have to be in alert, we have to be in preparedness. There is no technical proof yet that we will be anticipating a surge. But in case of any eventuality, action of central government is that we will be preparing ourselves, we will be speeding up our surveillance, we will be focusing on our testing. And number 3, if situation arises for treatment facilities, all the things required to be in place, and the service providers they need to be sensitized. Again, it is a reorientation. So I will tell about my state's preparedness that we are continuing surveillance. We have not let down our surveillance in our state. It is still on. We are testing. And the thing is that we are sending some samples, percentage of sample for WGS, but as per Government of India's direction, we will be sending everything, every positive sample for WGS sequencing. Number 3, we have ample sufficient amount of drugs and logistics for treatment purposes, and our logistics for our investigation, lab investigation, swab collection, it is also we do not have any problem. And Odisha is oxygen surplus state, we do not have any problem in that. And though we do not have patients, we have sufficient beds ready in our government hospitals. There is a clear-cut instruction from government. And if eventually arises, we will be enlarging, increasing it more, taking into loop all the private hospitals. It is our government's commitment to provide all sorts of services as mandated free for these cases, and we will be doing that. This is my humble appeal to all: do not make a crowd, avoid crowd if you are symptomatic, and if you are symptomatic, test yourself. And when you are in a crowd, take personal protection. It is the community's responsibility to behave in a proper way so that the chances of propagation will be less.
There will be any guidelines for air passengers?
Air passenger, Government of India has indicated that all the international passengers from these countries will be screened. And to our positive aspect, we do not have any direct international flight. All the flights, international flight, they come to certain point, and again by domestic flight they come. So as the first level of screening, it is at the arrival level. We do not have a much problem in that. Number 2, but seeing the eventuality as Karnataka started, if required, we will be putting our surveillance measure in the airport
so
also.
Odisha is all set?
Yes, we are all set. We are working in a team. We had worked in a very adverse situation and delivered. Hope with community's participation and able guidance of our government, we will deliver.